Hello and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this episode, Dr. Cassandra Vonnes, a gerontological nurse practitioner and member of the GAPNA Communication Team, talks with Dr. George Peraza-Smith, president of the Gerontology Nursing Certification Commission. Dr. Peraza-Smith discusses his dedication of being a nurse treating patients across the lifespan, from pediatrics to gerontology, the role of APRNs in the care of older adults, the importance of continuing education and obtaining nursing certification in the specialty of gerontology, and the mission and vision of the Gerontology Nursing Certification Commission. We are pleased to present Dr. Vonnes' interview with Dr. Peraza-Smith.
Hello all, this is Cassandra Vonnes, your host for GAPNA Chat. Our guest today is Dr. George Peraza-Smith, a faculty member at South University. Dr. Peraza-Smith is a fellow of the American Association of Nurse Practitioners and has been a practicing gerontological nurse practitioner for over 22 years. George is the immediate past president for the Florida Nurses Association. He is the president of the Gerontology Nursing Certification Commission, or GNCC. The GNCC offers an APRN Gerontological Specialist certification to distinguish APRNs who possess expert knowledge, experience, and skill in managing the complex health needs of our older adults. And we look forward to hearing more about the certification. First, George, suppose you're having a conversation with your 20-year-old self. Why geriatric nursing?
Thank you, Cassandra, for inviting me. I appreciate the opportunity to talk about the GNCC and the certification and gerontology nursing in general. I've had the pleasure of being a nurse across the lifespan. I started in neonatal ICU. I was one of the first neonatal ICU nurses at Texas Children's Hospital in Houston. So I've been in nursing for quite a long time because there's many more men in neonatal nursing. And loved it and loved everything about it. Went to med surg, went to neuro, did a little bit of surgery and oncology. And I loved it all. It was great. But when I was thinking about going back to school to get a master's degree and on to possibly a doctorate, I really sat and thought about what practice I wanted to do. And of all the different practices, working with older adults was what I loved to do. They're grateful, all those things that people say. They're grateful, they're pleasant to work with. Even those that are cantankerous, I love working with them, because of their rich history and what they bring and the complexity of their care, that you have to kind of just dig deep and listen to their stories. And I'm all about stories. So I love stories and love to hear stories. So I've just always loved to working with older people and being with them and being present with them and really talking to them. I would still say take that journey through other specialties, but you're going to light on gerontology and you're going to love it. And as you go through that journey, pay attention to that. Pay attention to those older adults that you're working with in the various clinics and units, and really pay attention to that. That's what I would tell that young whippersnapper.
Thank you. The GNP curriculum has changed a lot since you and I completed our programs. Can you share with us the result of the consensus model for APRN regulation that came out in 2008?
I think I have mixed feelings about that, the result of that. And I've come to some resolution about that and some understanding, and probably leaning more on the positive side of that, in that when the discussion about the consensus model was in place as it related to gerontology and geriatric patients, there wasn't a lot of GNPs out there. One of the lowest certifications that were being obtained. There were very few programs, and the programs that were out there had very few students compared to, adult and family and acute and all those other types of programs. I understood that we needed to prepare more nurse practitioners or APRNs to provide care for older adults, because that's what they were doing already, right? And so we just needed to codify that and to ensure that the competencies and skills were part of the training of APRNs. And so I can buy into all that. And then the retirement of the GNP, that's my original certification as a GNP. I will always be a GNP. I still have the certification of GNP and I will continue. I'll never let it go. With that merging of the two roles or specialties of focus, I think did increase the access of older adults to those who had some competency around providing care for older adults. However, one of my fears at the beginning was that what would happen is we would do watered down gerontology in the adult gero programs. It would be really focused heavily on adults and very, couple of slides at the end of a lecture or clinical practice area that covered gerontology. And in some ways that did occur, but I think over time, we're trying to fix that. My concern is when the GNP went away and we're all kind of starting toward retirement, that who's going to be those specialists that provide that competency, that ensure the competencies and skills are there for those who are adult gero or family or any of those? Who's going to be those leaders that are going to ensure that? That's the role for GAPNA. I am very strongly understand it and support that that's our role in GAPNA. But in terms of the training and education, it leaves a big hole. And I think that when the consensus model was implemented, we lost that. We've lost that geriatric complex healthcare skill set in the nurse practitioner arena, we are losing it as GNPs fall off of the treating patients, retiring, doing whatever else they might do.
That is true. Oftentimes just relegated to the slide at the end, age-related changes.
Yep, exactly.
So, and as a nurse educator, you had to evolve with that. And how did that impact your education? You educating nurse practitioner students as a result of the consensus model?
To me, how it's affected me is that I have to be a cheerleader for older adults. I have to get them to understand the complexity of gerontological patients and helping them and understanding them and creating some excitement about treating them versus, oh, okay, you just added this to me. So I think that's been my challenge. It's been my challenge with fellow faculty, such as the adult gero and family faculty who believe that they've gotten the geriatric piece just as they've gotten the rest of the family or the gerontology or the adults in their program. It's just ensuring that we keep bringing it up, that we keep talking about the older adult and how care is different for them and how treatment is different for them and taking histories and physical assessments is different for them than an adult, middle-aged adult. And just kind of just keeping that on the forefront of everybody's mind.
Similar to a challenge that medical schools face also as a special population. You had mentioned before that it was important that we talk about competencies. Could you explain the differences between competencies and proficiencies as it relates to us?
Absolutely. And I think there is some confusion around that, especially since we published the consensus model or the consensus statement around the proficiencies of this gerontological specialist role. In terms of the differences, I guess I'd have to go to Bender's model in terms of, competencies as a practitioner that's been in practice for 2 to 3 years, really understands guidelines, understands the application of guidelines, understands the treatments, has really concrete knowledge of what's occurring. Whereas proficiency, I feel, is a deeper understanding. It's more seeing patients and thinking about patients and conditions from multiple ways of knowing, not just the knowledge and the experience, but more ways of knowing, that intuitive thought as it relates to care of older adults. And the specialist exam that we have, or certification we have, tries to capture that proficiency level. So to me, it's like the GNP, when we graduated as GNPs and we were competent after 2 to 3 years, we were proficient after 5 or 6 years, really with that intuitive understanding, complex healthcare, complex older adults, the interplay of diagnoses and medications and all those things that I feel could become lost if we didn't have this kind of certification to kind of bridge that gap, to acknowledge and to recognize those with that additional expertise beyond the competency level of working with older adults. So beyond the competency level of family nurse practitioners working with adults, beyond the competency of adult geros working with geros. It's that next step, the more proficient, more deeper understanding and treatment and care for older adults to ensure that we have high quality outcomes.
Thank you. That helps a lot. When we were in the process of developing the advanced certification, GAPNA did a national practice survey in 2013. What did our organization learn about advanced practice nurses that were providing care for the older adults?
So the leadership at GAPNA was very interested in the impact of the consensus model on gerontological care and geriatric nurse practitioners or adult gero nurse practitioners. And so what we learned is that we have providers of all stripes working in multiple areas where older adults reside, come for their healthcare, communities. We had practitioners out there who were providing these higher level services to older adults that kind of help validate our need to recognize those proficiencies. So it was serendipitous in terms of how this all kind of occurred. The survey was for a specific reason in terms of documentation, but it became sort of the driver toward the proficiency statements and then the driver toward the certification, because we want to pull out and recognize those who are proficient at providing complex healthcare services for older adults.
So help me as I craft my elevator speech for the certification. Help me define the APRN, Gerontological Specialist.
So I'm not really good with elevator speeches, as you can tell, but I will work on it. I think that for the APRN Gerontological Specialist, it's an individual, an advanced practice nurse who is proficient beyond their basic certification. So beyond competency, it is a way of distinguishing their expert knowledge, deeper knowledge and skills as it relates to proficiencies and providing and managing complexities of older adults, healthcare needs, and to improve the overall outcomes of older adults with complex healthcare needs.
So you've shared with us some of the distinguishing characteristics. If you were to talk to me, a GNP, what would the direct benefit be to me and my practice in completing the certification?
Absolutely. I'm going to do the touchy-feely first, okay? Because I'm really a believer in the touchy-feely part of this. I have been with GAPNA for many years. I support our mission, our vision, where we're going. I am so grateful for the creation of the GNCC in terms of being able to have this certification. But I think it would benefit all of us. It would support your association. So those of you who are really GAPNA members who have GNPs, this would just add to that. And it would get more GSCs out there so that other providers could see GSCs and go, hey, what does that mean? What is that? Get some understanding of the importance of that, whether they're GNPs or adult gero or family or any other ARNP. And also it would get employers seeing, well, what is this GSC? And maybe get payers and policies kind of in place that will help expand GSC. We have to start somewhere. I get it. In my mind, the GSC is the GNP after you've been a GNP for a few years. So I get it, the resistance to not do that, but I think we owe it to our profession. We are becoming fewer and fewer, and we need to be sure that the next generations have geriatric specialists, nurse practitioners, providers, APRNs, clinical specialists that can provide that level of service to complex healthcare needs. So I think it's a marketing kind of think marketing and support of GAPNA and then support of our profession. So that's my touchy-feely piece. I really believe in our association. I think it also helps communicate that geriatrician kind of specialist proficiency. If we talk that this is not a basic certification, this is to document the expertise I have related to working with geriatrics so that it can be communicated to my employer. Maybe you get additional pay to negotiate additional pay because I have this certification, to mentor others toward this certification and understanding the importance of it. Then I think on a global perspective, with fewer and fewer of us, I think having the GNC allows others to see at the policy level the importance of this particular certification as it relates to APRNs providing services to older adults.
That's a beautiful description of the process measure to increase our numbers and visibility. What kind of clinical outcomes do you hope to see around the certification?
I would hope to see that GNCs with that expertise knowledge having better outcomes, improved outcomes for a population of older adults, being able to be at that level of providing services and reducing costs and trying to really provide the correct services for older adults versus this hodgepodge of fractionated, uncoordinated care that many of our older adults give, that we could, as GSCs, provide that kind of stability and connections and providing services that meet the needs of the older adult while also improving outcomes and cutting costs.
That's a beautiful case for employers, insurance companies, for long-term care, in hiring someone that's very proficient in their care and looking at those outcomes. When we're talking about academia, how do you feel that your participation in the GNCC impacts your direct ability in educating the future nurse practitioners?
This is a very interesting question, and I appreciate the question. And I kind of alluded to it earlier when we were talking about some other stuff earlier on in this interview. But to me, it's that geriatricians don't get forgotten, that older adults are not forgotten and lumped into the same pot that middle-aged and young adults are, as if they can be provided the same services at the same rate, at the same time, and achieve the same outcomes, because it's very different. It is a little more intensive, but there's also younger and healthier older adults who could actually benefit from GSCs in terms of ensuring that they remain healthy, that they remain disease-free or limited in diseases that they may get. And so I think that it's just bringing that to the forefront, because, a lot of times in our educational system of nurse practitioners, specifically the family, adult, gero, primary care, we're really focused on that primary care intervention. So making sure that we understand that the greatest impact can be done by really focusing our primary care efforts on older adults and ensuring that they remain as healthy as possible and as highly functional as possible and age in place appropriately. Being that advocate, I think, is the role that I see us in education as GSCs as well as GNPs, just being that advocate, ensuring that older adults are not forgotten and that we're always reminding folks to come back. Okay, what about the older adult? How are we going to do the older adult differently? What do students need to understand? What do students need related to providing services for older adults?
Well, you've sold me,
Super,
George, completely. What do I do next? Are there special requirements for me to be able to sit for the certification? What's my next step?
So the exam is at the proficiency level. So the exam was written by nurse practitioners who've been providing services for older adults for 4 to 5 years. So that's the level of the certification, or the outcome is looking for proficiency. So we're looking for those with experience. I think it's 2 to 3 years of experience with 50 hours of education. When gerontologically specific, you have to have a foundation. I've not come up with a really good term yet, but I guess the term that I've kind of settled with is foundational certification. The consensus model certification as an APRN, either adult gero, family, psych mental health. I mean, any of those are acceptable. Any of the roles specifically, those are focused, but any of the roles, even nurse anesthetists could possibly sit for this exam, because it's really about providing holistic care across the continuum for older adults at the proficient level. Now, our target is family nurse practitioners, adult gero primary care nurse practitioners, even acute care nurse practitioners. That's our target in terms of what the certification is really looking to grow and to have the biggest impact in terms of recognizing and acknowledging and those who have those proficient skills at that level of practice.
So I can go on the website, and at the end of the podcast, we'll provide our listeners with information where they can find out more about the GNCC advanced certification for gerontologic specialists.
And I also encourage them to go to GAPNA for some resources around studying for the exam. This test was developed by those who are proficient. So if you have been practicing at least 50% of your practice with older adults across the continuum in care, then you, by your experience, it's not a knowledge test, it's an experimental exam, just from your experience would be able to pass this exam. But I do get we're all nurses and we want to do the best we can on our certifications. We want to pass the first time. And so I think GAPNA has developed some really good resources around how to prepare for that exam. There's even a virtual or recorded certification preparation course that they did at a pre-conference a couple of years ago. There's booklets that they've been releasing. There's another one coming out soon that one of our GAPNA rising leaders developed to really help one prepare and understand what's on the exam.
Good. That'll be a project for 2022, a great goal for all of us. Would you share any regrets with your younger self, thinking back to that young nurse in Texas in your pursuit of geriatrics?
On many levels, I don't believe in regrets. I think things could have been different. I do. I don't know if this is a regret, but if I could do it again, I'd probably jump into geriatrics much earlier than I did in terms of picking it and lighting on it and deciding that this is what I want to be a specialist in. I would do it much earlier in my career. So not regrets, just maybe do it a little differently.
Wonderful. Anything else that you would like to share with our audience?
I just appreciate you allowing me to speak about the exam and speak about GNCC. And really, I just encourage those of you who believe in gerontology and believe in our specialty and want to promote and ensure that we survive the future to consider taking this exam, demonstrating your expertise to others and to your employers and to the community and to other providers. I just encourage you to do that. Thank you so much for this opportunity.
Thank you. That's been GAPNA Chat with Dr. George Peraza-Smith. Thank you again.
Thank you.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. George Byron Peraza-Smith has been a certified gerontological nurse practitioner for over 20 years. He teaches gerontology nursing to undergraduate and graduate programs and maintains a practice in long-term care and primary care. Dr. Peraza-Smith is a graduate department chair and professor at South University in Tampa, Florida. Dr. Peraza-Smith has been an active GAPNA member serving as the Treasurer and Chairperson for the Geropsychiatric Special Interest Group. He was a co-author with the consensus statements on Proficiencies for the APRN Gerontological Specialist and currently serves as president of the Gerontology Nursing Certification Commission. In 2020, Dr. Peraza-Smith was awarded the Dave Butler Spirit of Gerontological Advanced Practice Nurses Association Award. Dr. Cassandra Vonnes is the Nurses Improving Care for Health System Elders Coordinator, Geriatric Oncology at the Moffitt Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association Communication Team and is a host of the GAPNA Chat podcast series. To learn more about becoming an APRN Gerontological Specialist certified, visit the Gerontology Nursing Certification Commission's website at gapna.org/certification. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.